being a paediatric patient, quite often we'll see children and adults that have experienced trauma either side of the swimming pool or the children's birthday party, and I find these patients really, their needs are slightly different to the average dental patient that may come through the door. They often have teeth that are broken, they may have bony defects, and when we diagnose this, we will always get a consultation from Dr. Rocchietta.
Oh yes, because unfortunately it has to be said that not all children unfortunately have accidents, and especially when we're talking about the front teeth, these accidents may be very severe, and the first thing somebody sees is the broken tooth, but in reality there is bone underneath that can be severely broken, and sometimes they say, oh, there's nothing to be done and bone cannot be regenerated. Instead, we can rebuild the bone in a very predictable way, and especially we use products which we call off the shelf, which means we don't use your own bone, so it is less traumatic. So we call it a minimally invasive surgery, and you can get a big volume of bone to be able to position a dental implant, and then this allows the treatment to be completed and potentially even the orthodontic treatment to finalize the whole treatment. And the ultimate goal is to reproduce a very harmonious and natural looking smile, and this is at the end of the treatment what we really strive for perfection to achieve.
One of the things that parents ask me is, quite often they'll come to us and we may be a second or a third opinion, and the parents will say, well, we've been advised to have this broken tooth taken out. Why would you not immediately take up that option?
Of course, well, sometimes they say the tooth has to come out. Sometimes we can actually save the tooth, and there's nothing like saving your own tooth. And again, I see a lot of patients who tell me, please, I would like to have an implant. And I tell them why. And they said, because my dentist said that tooth has to come out. But sometimes you can save teeth, and saving teeth is definitely better than positioning an implant.
I think definitely for a young child, what's the youngest age that you could fit an implant?
The growth has to be completed, so not earlier than the age of 19.
And what's the kind of average lifespan of an implant nowadays?
It's a very tricky question, but we have to be very cautious. The message that was given many years ago was that implants were for a lifetime, which is absolutely incorrect.
Okay.
So we need to tell the patients that implants may last a lifetime, but they may also last on an average, by the literature that is behind us, around 15 to 20 years.
So at the end of growth, you're talking about approximately 17 or 18 years old?
Yes.
And if you're talking about a 15-year span, they could potentially be having another implant fitted in their early 30s.
And that's why we need to save teeth.
Okay, so potentially if you can increase the lifespan of the tooth, even if it's broken, and rebuild that and save it, you can then put off having the implant till later on in life.
Exactly. And this of course is coupled by a thorough understanding of the whole mouth, the whole patient, what happened, and this is also coupled, it must be said, to the goodwill of the patient and its maintenance regime. And that's why we follow up on patients on a very strict and regular basis. They need to clean well, and they need to take care of their dentition, whether it's saved or whether it's an implant.